Good day. I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. As a part of the continuing medical education program organized by Padma Clinic and Nursing Home, Chennai, I will be now today talking to you on the second phase, that is the part 2 of Parkinsonism, which is the causes. Now, the causes of Parkinsonism are one, idiopathic Parkinsonism, where you do not know what is the cause. The other one is secondary Parkinsonism as a result of some other disease. Then Parkinsonism plus syndromes, where you find Parkinson along with some other cancer disease that is involved, and Parkinson features seen in certain heredodegenerative diseases. Idiopathic Parkinsonism is one where you find etiology is not known, but several theories have been postulated. So, they are Parkinson's disease that is described by James Parkinson, the sporadic form as well as the familial form, that is idiopathic Parkinsonism, the clinical features of which I have elaborated on a previous session. The secondary forms of Parkinsonism are one, the drug induced, dopamine receptor blockers can produce it like neuroleptics, antiemetics such as metoclopramide. Dopamine depleters like reserpine, tetrabenazine can also produce Parkinson's features as a side effect. Calcium channel blockers like flunarizine, cinnarizine, diltiazem. Lithium, methyl dopa, hemi-Parkinsonism, hemiatrophy syndrome. Then hypoxia, conditions that produce hypoxia can also produce features of Parkinsonism. Infectious diseases, post-encephalitic Parkinsonism, acquired immunodeficiency syndrome can also present as a Parkinson's features. Intracytoplasmic high inclusion disease, Jakob-Creutzfeldt's disease, subacute sclerosing panencephalitis. These are some of the infectious diseases that can produce features of Parkinsonism. Metabolic can also produce metabolic conditions like hypocalcemic Parkinsonism, acquired hepatocerebral degeneration like chronic liver insufficiency can produce Parkinsonism. It can present as a paraneoplastic feature. Then syringomesencephalia can also produce Parkinsonism. Several toxins can also produce Parkinsonism like carbon disulfide, ethanol, carbon monoxide, manganese, cyanide, methanol, disulfiram and MPTP. Then the trauma can in fact also sometimes present with Parkinsonism after a trauma, post-trauma. Tumors, vascular like multi-infarcts, Binswanger disease etc. can produce Parkinsonism. Now, Parkinsonism plus syndromes like the diffuse Lewy body disease, progressive supranuclear palsy, corticobasal degeneration, multiple system atrophy with predominant Parkinsonism called MSAP, multiple system atrophy with predominant cerebellar ataxia, MSAC, Alzheimer's disease, Parkinsonism, dementia, amyotrophic lateral sclerosis, progressive pallidal atrophy. And then of course, in certain heredodegenerative diseases, there are several of them where you find Parkinson's features can occur. Ceroid lipofuscinosis, X-linked dystonia Parkinsonism, Gerstmann-Straussler-Scheinger disease, which is a prion disease, disinhibition dementia Parkinsonism, familial OPC amyotrophic lateral sclerosis, autosomal dominant Lewy body disease, Huntington disease, hereditary ceruloplasmin deficiency, dopa responsive dystonia, and other hereditodegenerative diseases are also there like familial progressive subcortical gliosis, familial basal ganglia calcification, Mercado-Joseph disease, which was earlier called as a type 4 OPCA, olivopontocerebellar atrophy, then familiar Parkinsonism with peripheral neuropathy, mitochondrial cytopathies with striatal necrosis, Parkinsonian pyramidal syndromes, neuroacanthocytosis and Wilson's disease. Whenever all these of course we cannot treat, but if you take up Wilson's disease is one where a treatment is available. Therefore, a young patient or any patient for that matter presenting with Parkinsonism, try to rule out abnormal copper metabolism, you see, and then if there is, it can be treated. That is very, very important. So, That's in fact the various broad, you can actually classify the various based on the causes like idiopathic Parkinsonism, secondary Parkinsonism, Parkinsonism plus syndrome and heredodegenerative diseases. Thank you very much.